The Dualign OA is a conservative treatment option designed for people suffering from symptoms associated with osteoarthritis of the knee. The Dualign OA provides support and offloading to the affected side of the knee using a double upright offloading design. This system helps knee alignment and improves stability over a single upright option while effectively offloading the affected compartment. Reducing pressure on the injured compartment helps to reduce symptoms, which then leads to increased daily activity. The Dualign OA is simple to apply with the patented, easy-to-use one-step buckle system. The premium pad materials make it comfortable to wear. The lightweight, low-profile design allows the patient to wear the brace under their clothes. Ease back into mobility with the Dualign OA. This video outlines brace fitting instructions for clinicians, as well as at-home care and use instructions for patients during the healing process. A clinician will first measure the user's thigh, knee, and calf to determine the appropriate brace size. To apply the brace, first ensure all one-step buckles are open. They can be opened by pressing the side button. The patient will need to sit with their knee bent at a 30-degree angle for proper placement. Now, slip the patient's foot through the bottom of the brace, just above the lower calf strap. Align the condyle pads around the knee so that the center of the hinges align with the center of the patella. Adjust and tighten straps before closing them into the fasteners. Be sure not to over-tighten, as this could lead to injury or discomfort. Reattach the one-step buckles and straps, beginning with the lower shin strap. Secure the remaining straps in the following order: 2. Upper rear thigh. 3. Lower rear thigh. 4. Upper shin, and then tighten the front thigh strap and the rear calf strap. Next, you will need to adjust the varus or valgus alignment of the brace using the adjustment key and mechanisms on either hinge. The brace needs to be adjusted to unload either medially or laterally, depending on the affected compartment. The knee compartment will be unloaded contralaterally by adjusting each mechanism until even pressure is felt on the corresponding condyle pad. Adjust each mechanism 1/8 of a turn at a time. Between each adjustment, allow the patient to walk around to evaluate if the pressure applied provides appropriate relief. Clinicians can also determine if flexion and extension limits need to be set. To adjust the range of motion, remove the condyle pad from the brace and remove the screw for the limit stop. Remove the limit stop from the hinge and insert the required angular degree. Secure the inserted limit stop with the screw and reattach the pad. Make sure this step is repeated on the opposite hinge. For a flexion stop, insert into the back of the hinge and use the extra screw that is attached to the flexion extension tree to secure. Again, make sure this step is repeated for the opposite hinge. Clinicians can also cut the brace straps to the appropriate length for the patient. To cut the straps, open the strap pad, open the end of the binding strap, then separate the hook and loop material and the binding strap. After cutting, attach the pad back to the end of the binding strap. The brace should stay in position and not migrate up or down while the patient is walking around. Clinicians should always determine proper adjustments, wear time, and flexion and extension limits. To properly remove the brace, press the button on the side of the fasteners to release the straps, then take off the brace. Reapplication is easy. Simply click the fasteners back into place. The Dualign OA knee brace can be hand-washed and air-dried. Pads can be removed from the frame by pulling the hook and loop apart. Wash pads with mild soap and water. Rinse thoroughly and allow to fully air-dry. Remember to place the pads back onto the frame before applying the brace. For more information regarding the Dualign OA brace, please visit aspenmp.com or contact Aspen's customer service at 1-800-295-2776.